I want to welcome you to the new Alberta Children's Hospital. I believe that it's the future of children's health care, and I hope as you get an opportunity to look through this facility, you come to see the differences between the past and the future. And it's with great pride that I stand here, and possibly some relief, to celebrate today, because we're essentially at the end of construction of this magnificent new hospital. We're going to use some words today that you don't hear very often in today's hot economy. We're on time, we're on budget. And really, as you get an opportunity to look at the space here today up close, it's hard not to be impressed. From the multicolored Lego block exterior to the spacious sunshine-filled rooms inside, I think we can all agree now that this hospital is quite simply a dream that's come true for children and for all of the people who shared that dream at the beginning, and starting on September 27th when we open the doors, certainly for the patients and staff that will be working. And I can tell you that from the bottom of my heart, that just being a part of this project and watching it unfold has been one of the most rewarding experiences of my life. Of course, every dream needs a dreamer, and in this case, there were an awful lot of them. And I'm going to try to thank some of them and recognize them here today, but I can't possibly capture them all. From conception to completion, the building of this hospital has been a collaborative effort. It's been an effort with a single focus, and that is better care for our children. It all started, and I'll say just 7 years ago, but those are a long 7 years, when a group of community leaders got together with the people from the Calgary Health Region to discuss building a new hospital. The vision that emerged from those early talks was for a building that would set new standards for design and create opportunities to enhance the care being delivered to the children in the community of Calgary and the surrounding area. And that's where the dreaming started. Now, I have to say that I knew early on that this hospital would be something special, simply because I've been working with the Calgary Health Region long enough to know that that's just their way. But I certainly couldn't have predicted that it would turn out to be the architectural tour de force that it truly is. And there's a surprising reason for that. In 2002, our architects created renderings of how the hospital would look. And they envisioned a multi-story brick building, not unlike the many other new hospitals around the country. The drawings were brought to the hospital's board, to the staff, and everyone agreed that they looked appropriate for the job that needed to be done. And then they brought it to the teen advisory group, which the region had created to provide feedback on the design plans for the new hospital. And the truth is, the kids just didn't like it. It was too dark, there were no windows, there certainly wasn't enough color, and so they were given the opportunity, and they seized the opportunity to produce their own renderings of what that new hospital should look like. And you can see a lot of those renderings here today in the hallways as you're walking through. You have to admit that the difference in perspectives from the brick edifice at the old Children's Hospital to this hospital today is remarkable. And to their credit, the architects quickly and masterfully incorporated the kids' ideas into the plan. By the end of the design process, more than 300 staff, 80 parents, and over 100 children had been consulted, and their input had been incorporated. And the result of that is the colorful, kid-friendly building that you see here today. The truly amazing thing about the collaborative process is how the design ideas coming from parents and children's meshed with our overall goals. All hospitals are populated with people dedicated to delivering care. But in building the new hospital, we also wanted to ensure that the environment itself would be conducive to reducing stress and promoting healing. To that end, and with the help and input of parents and children, we were able to design a hospital that truly reflects the family-centered care philosophy that's the cornerstone of the Alberta Children's Hospital approach to healthcare. Let me give you a couple of examples. Every single one of our inpatient rooms has a bed for parents and a private washroom, shower, and bath. We have a babysitting service for siblings of patients. We have a sacred space for spiritual activities and healing gardens that surround the new hospital, giving parents and their children areas to heal, to have fun, and to spend some private time. My favorite example of the collaborative process at work is the pet room. One of our advisory group children suggested that the new hospital should have a petting zoo. I think that's a wonderful idea, but it wasn't feasible. One of the designers, though, did figure out that if we could have a pet room, that means a youngster who's in the hospital today can have a visit with the family puppy, the family kitten, and it's no small thing to have that happen. It is, in fact, a healing process. The room itself is just a small room off the side of the building, but it's a big thing to the sick child, and it underscores our commitment to looking at things from the perspective of the young patient. Here's some other interesting facts about our new hospital. The building is more than 750,000 square feet in size. That's 60,000 or 60% bigger than our previous hospital. The emergency department is designed to serve 60,000 visits per year. The existing hospital, the existing children's hospital, was designed for 25,000 visits per year and is currently dealing with about 49,000 visits per year. Inpatient rooms have a view of Nose Hill Park, the Bow River, or the Rocky Mountains. In addition to the parent beds in the inpatient rooms, the new hospital also has 6 family accommodation suites, each with a full washroom, laundry facilities, and a common kitchen and dining area. There's even a fireplace. We have a large auditorium, complete with an 11-foot by 20-foot movie screen and state-of-the-art sound system for our patients. And most of that facility was donated by Calgarians. Our hospital truly is filled with the dreams of many, many Calgarians, all who contributed time, money, and ideas. The dream couldn't have come true without the support of our community. Without each donor, champion, and stakeholder, this new facility wouldn't be here.